Thank you very much, and let me say first of all what an honour it is for me to be invited and be given the opportunity to come here and speak with you. So we've got 6 lectures, and I realise some of you can be in some and out at others. That's absolutely fine, and we are being recorded, so I doubt if it'll go viral, but I'll try and be honest and frank, but not rude about anybody. I'll try and manage that. Right, I would like it to be as interactive as we can, so because we're not a huge group, I think it's entirely all right to have questions or comments, or if at some point you just say it again, repeat it, or tell me it again another way. Please do, please do. Right, let's just go back to starting point. Health economics and social capital. This picture, I don't know if it's clear enough. I was attending a health economics conference in Spain. Pamplona, I think it was in. And this was a student artwork or exhibit that was in the building where the conference was being held. And so you can see what the student thought about their studies. This chair is a bed, is nails. This is a literal bed of nails. Reading is like having nails put in your eye, and you can't even put your elbow on the table and relax. There's nails there as well. Now I put that up because this course is going to be the opposite of that. It's not going to be hard, nails, uncomfortable. We want it to be quite the opposite. And I don't want you to have any association in your mind between health economics and pain or discomfort. I mean, yes, we're interested in sickness and health, so there is pain there, but not during the class, please. Right, just an overview of what we're going to look at. The first lecture, imminent, this morning, what is health economics? Now, I know some of you will know what health economics is, some of you will think you know what health economics is, and some of you will be wondering, what is it? Why did my professor encourage me to come along to this, if they did? And so that'll be the first thing. Just try and give you a flavour of what's involved in health economics. In the first lecture this afternoon, I'm going to move on to social capital and look at some of the issues involved in measuring social capital. And it's really difficult. Not difficult in the sense that mathematically difficult or technically difficult. It's just difficult, first of all, to arrange and organise the different concepts of social capital. And then having decided what the concepts are, it's really quite challenging to decide what might be a good measure or good measures of social capital. And we'll look at that this afternoon. Then on Monday, 11 o'clock I think, I'm going to look at specifically social capital in the context of health economics. What have health economists contributed or tried to contribute to the study of social capital? I think it's fair to say that health economists came along quite late to social capital. It's only about the last 10 years or so, slightly longer, that health economists have been very interested in social capital. But health economists think they have something distinctive to contribute, and I'll try and convey to you the contribution or potential contribution of health economics. Then Monday, I guess 1 o'clock, is that right? Yeah. I'm going to think about the implications for health policy and for research. Implications arising from the potential role of social capital, and trying to understand the role of social capital, what implications it might have for health policy. And then on Wednesday, 11 o'clock, I'm going to talk more broadly about the role of economics in priority setting. priority setting in a health context. So what are the sorts of decisions that health economics and an economic approach might help us with? And then the final lecture is going to look at a particular problem, and it's a problem in every country in the world. It's certainly a problem in England, but I'm sure it's a problem, I know it's a problem in Japan. It may not get a lot of attention, and it's the issue of high-cost medicines. New medicines are, by and large, wonderful things. Frequently, they are bringing potential benefit to patients who have serious problems, sometimes problems that we've been unable to deal with in the past. So they're good. Unfortunately, they frequently are very costly. And what that implies is if we're going to spend on these new medicines, we're going to have to take the money from somewhere else. Now, it doesn't matter where we take it from, there is going to be sacrifice. You could take it from another part of the health service, and there'll be obvious loss of benefit to patients elsewhere in the health service. You could take it, as it were, from another part of the economy. You could move more resources into the health sector. But there's still a price to be paid, the sacrifice. You're losing the benefits of spending elsewhere in the economy. And so in the final lecture, I want to look at some specific examples of this challenge, and there's two areas I'm going to look at. One is treatments for HCV, or hepatitis C virus, HCV, and it's a particular issue in Japan because you have a relatively high prevalence of HCV. And the other one I'm going to look at is in the context of new cancer therapies. And particularly, I'll look at non-small cell lung cancer. But it doesn't really matter which cancer area we take. Thankfully, there's lots of new treatments coming along, but they just all have a very high price tag and give us this real problem, this challenge, that how are we going to be able to afford them? In what circumstances perhaps should we say no? And that's a tough decision, but the argument is that health economics can help you with that decision. It doesn't take it for you, but it can help you organize your thinking. It can help you interpret evidence that's relevant to your decision. So that's what we're going to cover, and I hope there's a bit something in there for everybody. I realize that some of you might be more interested in social capital aspects, some of you might be more interested in economic evaluation or cost effectiveness aspects, but that's what we're covering. Now, is there something somebody would love me to cover that I'm not planning to cover? Or you can tell me at the end, once we get to the end of the 6 lectures, you can say, well, that's fine, thank you, Professor, but why didn't you talk about, and well, we'll see, maybe come back again another time. Okay, so lecture 1, what is health economics? Oh, by the way, that's my email address. If you want to sort of communicate, well, do feel you can speak to the real person. You can do that, but sometimes people might have a query or a question or something that you don't want to look me in the eye, send me an email, or you might have something you want me to comment on or something, and I'd be happy to try and do that.